Hi, everyone, and welcome. Thank you for joining us for this webinar, and thank you to the presenters for their partnership in developing this. I am Galen Davis, a program administrator at the Governor's Office of Youth, Faith, and Family. GOYFF has started a webinar series to help raise awareness about domestic and sexual violence prevention efforts and to show Arizona's support for survivors and victims. This webinar is the second installment in our webinar series, and I'm very excited for the presenters to share their expertise on family and child advocacy centers. As a disclaimer, all webinars and resources have been developed by the presenters, and they are the presenters' opinions and views. We have Marina from Child Help, Missy Sakura from Yavapai Advocacy Center, and Diane Humphreys from Amberley's Place. We're going to go ahead and start off with Diane whenever you're ready.
Hi, and my name is Diane Humphreys, and I'm the co-chair of the Governor's Commission for the Prevention of Violence Against Women. I'm also the director of a family advocacy center in Yuma, Arizona, and it's named Amberley's Place. Arizona is a really unique state with rural areas, Native American reservations, and large metropolitan areas. Each family advocacy center is designed with the community it serves in mind. The names might be different, as in Lori's Place, Haven, or Yavapai Family Advocacy Center, but the services are all the same. In a family advocacy center model, we believe in using a team of experts on issues of family violence to respond to each request for help. This also provides for a victim to be provided services at one location, making it easier on the victim. Now, instead of going to the ER for a medical exam, it's done here. Instead of going to the police station to file a police report, it's done at the Family Advocacy Center. Sounds rather amazing, doesn't it? I will tell you that in Arizona is the leader for family advocacy models. Let's go on a tour of all the family advocacy centers in Arizona and see what's offered to you and the warm environment that's provided at each one of the various family advocacy centers or children's advocacy centers. This is a waiting room. When you enter a family advocacy center, you will notice that the rooms are warm and it is inviting as victims are coming here to tell their story of abuse. In the first waiting room, you will see lettuce fields and agriculture, as that is what Yuma is known for. In the next slide, you'll see that other FACs show the beauty of the desert or the comfort of home. From the moment a victim enters, they know they are someplace safe. Each victim is provided with an advocate to walk them through this process and ensure their victim rights are protected. Adult victims are taken to a family room to speak privately to their advocate. This is often the same room that they will meet a law enforcement officer in. Did you know that you can use the services of a family advocacy center with or without making a police report? Let's walk through some of our family advocacy centers further and see for yourself how warm and caring the environment really is. Now, here are some of the family rooms. This is where the adult victims of abuse will go. This is a private, warm room for a victim to learn about services, their victim rights, and let the advocate know if they need law enforcement to be called, if they came in on their own. The family rooms are also set up to be used for death notification if the crisis advocate is needed. We do these services as well. If the advocate has responded on scene when the report was made, they will take the adult victim to the right family room to begin this part of their services. Now notice how the decorations and furnishings are different, but they're all warm and safe. Each room has a comfort quilt in it. Sometimes victims come in, they're very traumatized. They just need to feel the warmth of the blanket wrapped around them. If the victim is a child, the victim and the non-offending parent is taken to a playroom. These rooms are designed to reduce the stress and anxiety that a child feels. Notice how they're all different. They're all age appropriate. Some rooms have rocking chairs, not only to comfort the child, but also the parent. Children come to the playroom to feel safe. If you'll notice in this one, where the hero room is, you have your everyday heroes, and then you have your superheroes. What we tell the children when they come in here, this is your room. You are a hero. You had the courage to tell someone hurt you. Notice that children that come into this room, they're about the age of 4 to 11. So they're old enough to understand and know by making this report, somebody's going to go to jail. That takes courage. So as you see the other playrooms, they're all themed differently, but the outcome is the same: to relax the child and let them know they're safe and they're not in trouble. This is our MDT room. This is a very important room. Now that victims have rights, which we've had for quite a while in the state of Arizona, this is where the team reviews the case. The fears and current concerns of the victims are brought into the team. The victims now have a voice in what the next steps will be. They can ask, when will an arrest be made? Can you let me know? So if it's a family member, I can be gone. I won't be there at the house. They can let them know if they're worried about retaliation from other family members of the defendants. How can we prevent this? What can we do if this happens? Or they can let them know if the suspect has weapons, access to weapons, or if there's drugs on the premises, so the law enforcement can take the needed precautions. Our next slide shows our interview rooms. Our interview rooms are designed for one forensic interviewer and a victim to go into the room. The rooms are once again designed to be warm and comforting. This is where the victim is going to tell their story. This is a hard thing for the victim to do, and it's so important that the forensic interviewer has been trained in knowing how to talk to a victim, ask them about the story of what happened to them, but also not re-traumatize them by the way those questions are asked. These interviews are audio and video taped. A copy is given to the county attorney, to the defendant's attorney, and also law enforcement keeps a copy. Our hope and our goal is that once the video is reviewed by the county attorney's office and by the defense attorney, that they will decide that they will not make the child or the victim testify in court. Hopefully that will be the interview that they need for this to come to some kind of a desired end for the victim. Next, you'll go and you'll see our medical exam waiting room. The medical exam waiting room is also designed for comfort of the victim. This private room is where the SANE examiner, the sexual assault nurse examiner, which we call them SANEs, and the victim or the parent of the non-offending parent will sit with the victim, and they will go over their medical history and explain the details of the exam to them, answer any questions they might have. Support is offered to the victims when they go in for the medical exam. Now, if you look at our medical exam rooms, they're also made to reduce the stress of the victims. These are for children. And if you'll notice, it's so stressful when you tell a child that there's going to be a medical exam. And so what we've done is we've provided an environment to make it a little bit easier for them. And this exam will be done by a trained forensic nurse who understands trauma and abuse. Child and adult rooms are available. They're also designed to take away that cold, sterile environment of the hospital. If you'll notice in this one, there's a comfort frog there. It's a weighted frog, and it can be wrapped around a child so they feel like someone is holding them and comforting them while they're going through the exam. Top of the line medical equipment is used with highly skilled forensic nurses, which have been trauma trained and know how to assist a victim of sexual abuse. The collection of this evidence is a very detailed science. Those involved must follow set procedures. This exam is free, and if the victim is an adult, they can choose if law enforcement is going to be involved in handling this evidence or not. If they aren't ready to report, it's called a Jane Doe, John Doe report. The only information given in that exam kit is a number. There's nothing to identify the victim. Our next room is our training room. These training rooms are very important to our process because we come together as a multidisciplinary team and we learn new practices and new ways to investigate crimes of abuse or family violence. As learning as a team, we can go out and we can immediately put this new training into place as we respond and assist victims of abuse. You'll notice once again, the training rooms are just like the others. They go to the community. Whatever that community is focused on, the training room goes there. It's themed for that. This is our sanctuary. Oftentimes, adults need to address fears and concerns on a spiritual level. And sometimes they just want to go someplace quiet, and that's what the sanctuary is about. We can invite their clergy to come and meet with them if they need prayer, if they need blessings, or if they just choose a private room that they need to meditate in. Our next slide is going to show you our kids' pantry, or the places where children can go in a family advocacy center or in a children's advocacy center. to get food and snacks. Victims need their basic needs met. Food and drinks are available for victims in a warm, carefree environment. Many of the family advocacy centers also provide food boxes for the emergency food for victims. The food is collected and donated by the community. This provides for their emergency needs 24 hours a day, 7 days a week, even when the food banks are closed. Now, our care closets, most of our care closets are stocked by the community they are in. Care closets provide for the hygiene needs of victims with diapers, formula, clothes and shampoo, and other items that are needed. The handmade quilts donated by various community groups and stuffed animals send a message of care and are like a warm hug for those who receive them. All items from care closets are telling a victim, we care about you, we support you, and we support your healing. Family advocacy centers and children's advocacy centers are supported by the communities they serve. Now, some of those have some of the family advocacy centers and children's advocacy centers have exit playrooms. This one is at Amberley's Place in Yuma, and it shows the victim as they move forward through the investigative process, they leave through the exit room. This exit room is a new place that they haven't been to before. They leave the story behind, and this is where they move forward, leaving the bad behind and moving on to their life free from the abuse. The questions are answered by the advocate to the mom. All of their fears and concerns have been addressed. And if you'll read the saying on the wall where it says, oh, the places you will go. And that's what we want the victims to know. It's up to you. You can go anywhere you choose from here. The abuse will not hold you back. If you look at the next slide, you'll see that artwork is really important in all of our family and child advocacy centers. Artwork is what we use as a tool to soften the environment of the Family Advocacy Center or the Children's Advocacy Center.
Hi, thank you, Diane. That's wonderful, and I love that overview of child advocacy centers and family advocacy centers across our state. My name is Missy Sakura, and I am the director at the Yavapai Family Advocacy Center, which is located in Prescott Valley, Arizona, and we serve all of Yavapai County. So what I'd like to do right now is take you through a few of the services that we provide and maybe take just a little bit closer look at those services and talk a little bit more in depth about what we do at our advocacy centers to support victims. Multidisciplinary teams are common practice across our state and across our nation, and they are evidence-based, and they're known to be proven to be what we know as best practice when we're working with victims of an interpersonal crime. Due to the complex nature of crimes against children in particular, but also interpersonal crimes against adults, investigations and family assessments really need to be coordinated by multidisciplinary teams. And what we do in these teams is we enhance the investigation, and we also support and promote the prosecution of these cases when they go to trial or go to criminal charges are pressed against anybody, a perpetrator. So it's really important that all of the players in multidisciplinary teams are coordinated and working together in these cases. And we do that for a few reasons. So I want to talk a little bit about each of the players. All multidisciplinary teams have core participants. That's going to be law enforcement agencies. Every advocacy center around our state coordinates with their local law enforcement agencies. Some of the larger advocacy centers in Maricopa may have a fewer amount of police agencies. They may have 2 or 3. Here in Yavapai County, we coordinate with 14 different law enforcement agencies. So it just varies around our state, depending on where the advocacy center is located and which jurisdictions are in their area. Department of Child Safety is a statewide agency, and each of our organizations will coordinate with that agency in regards to any investigations that they have regarding reports of abuse or trauma to a child. Prosecution is a key party to these teams. We want to make sure that we have the county attorney and the prosecutors on board. They really help drive that investigation, and they're there in this meeting and communicating with law enforcement to make sure that we're doing things immediately in response to what's happening in the investigation and there isn't any delay or lag time. Medical and mental health professionals are really key partners in these teams. We want to make sure that we're meeting the needs of these victims as immediately and as comprehensively as possible. So medical professionals and who are going to perform the sex assault nurse exams, SANE exams, as Diane was explaining earlier, and then our mental health professionals. So we have trauma therapists that will work with victims during and after the investigation for as long as needed to help them cope with that trauma. Victim advocates are really the case managers behind these cases. They're going to be that side-by-side partner with the victim as they're walking through this entire process, through the investigation, the trial, and then aftercare services. Advocacy center staff, which is going to be comprised of those victim advocates, and then also the director and the support staff are going to be involved so that we can help oversee the process and make sure that we have active team members who are all working at the best interest of the victims. And then we can include other professionals if it's appropriate for that case, whether that be juvenile probation, adult probation, sometimes professionals from the educational field, if they're highly involved with the child on a case, they may be brought into that team. So we want to make sure that everybody's really involved. One of the key players who is a detective up here in Yavapai County, I just really, I love some of the things that he says. He's about a 28-year veteran. And he says his favorite part about multidisciplinary teams is that, you know, the people in that room are all bringing their A game when they sit down to talk about a case. And so that's really, I always love to use that example. That's really primary for what we're doing. You can go to the next slide. This is a collaborative effort between agencies. So we do have formal agreements, memorandums of understanding that will typically be drawn up yearly and signed between all of these agencies that I talked about, or all of these team members, so that we all understand what our roles and responsibilities are to the victims and what our role and responsibility is to each other and also to the system. There are joint investigation protocols that are part of the laws of our state, and then each county has their own. And so those kind of govern these multidisciplinary teams and guide us in what we're doing and best practice. We also want to reduce how many times a victim has to tell their story, or how many times that those non-offending caregivers have to have interaction with those officials, those law enforcement and Department of Child Safety officials. We want to make sure we're doing that in those supportive environments that Diane showed you, and that we're answering all their questions as soon as possible, and also that they have that guided support by the victim advocates during this process. These teams are very effective in all types of child and adult abuse. So we primarily use them for crimes against children, child cases. We also, most advocacy centers, if not all, have sexual assault response teams. And then we will also review a multidisciplinary team setting cases of elder abuse, domestic violence, and we have human trafficking teams. So we know that each type of these cases, although they have a lot of overlap and similarities, when somebody's gone through trauma, we also know that they're very unique and different in many ways as well. So we want to make sure that the players on the team are customized to deal with that specific topic. So one of the other services I wanted to talk to you a little bit about today was our sexual assault nurse exams. As Diane said again, and here's a couple more pictures. Here are some of the SANE exam rooms that are in different centers in our state, and they are set up to be very warm and inviting and comforting, and you know, hopefully a little bit less sterile than a victim may have to experience at a hospital setting. The number one primary goal in a sexual assault nurse exam, we always want to make sure everybody understands, is for the well-being, medical well-being of the victim. We are going to be collecting evidence, but again, that's not our primary number one focus. That's going to be the well-being. SANE nurses are specifically trained. So I like to tell people that, you know, you can go to the hospital if an assault has happened. We have people call us and they ask me that question, and I let them know that they certainly can attend to the medical needs. But if this is something where you have had an assault and you either want to have evidence collected to contact law enforcement and move forward now, or that's something you might consider in the future, so you don't want to lose that opportunity now. It really needs, these exams need to be done by a SANE nurse. They're trained in many different ways above and beyond what their medical training is going to entail. So there's, of course, a level of confidentiality around our centers when somebody's coming in here for that medical exam. HIPAA certainly complies, but is there. But we also want to make sure that you know, they're not getting it billed on their insurance for a sexual assault rape kit. Everything is confidential that goes through our centers. The nurses are trained to reassure victims in regards to their fears around their assault or what could be going on. Possibly they could be really fearful that they've contracted some sort of sexually transmitted disease or something, or that they've become impregnated through, as a result of their assault. So our nurses are trained to talk them through that and to document everything that they're observing and hearing from those victims. We have specialized equipment at our center. So those are going to be cameras hooked to computers that can take photographic evidence, that have filters to see bruising and tissue injuries that might not be apparent to the naked eye. We have evidence collection kits that are issued through law enforcement agencies at all of our centers that the nurses are trained on utilizing and collecting evidence. And then we have medication available, so that antibiotics are going to be given, or perhaps a day after pill if that's something that the victim would choose to participate in. Our nurses are experts in testifying in court. So they will be testifying as far as what their exam has found, and they're going to be testifying as to how that victim appeared and what they were talking about during that exam. It's really important that we get these exams as soon as possible. It can be compromised or lost if it's not collected within a certain time frame. The sooner after an assault, the better. So for instance, biological evidence that's dried on somebody's skin could possibly flake off and fall off. We want to get that, we want to get those swabs taken as soon as possible. In Arizona, we can collect biological evidence up to 120 hours after the exam. So we want to make sure that we get that done if it's at all possible. And we want to make sure that victims know that they can have that done again, whether or not they want to move forward with prosecution. And that pertains to adult victims. Now, if children are involved and it's a child victim, we're all mandated reporters. So even if the parent brings the child to our center on their own and they haven't involved law enforcement at that point, we're going to need to get them involved. And we also may ask a victim to come back later on and have more photographs taken if we think that the injuries, or the victim notices if the injuries have become worse, we can switch. So there's different types of exams that our nurses are trained in conducting. An acute exam is that exam I just spoke about. It happens within 120 hours of an assault, and we're looking for biological evidence. A chronic exam is an exam that could be performed on somebody who has delayed reporting of chronic sexual assault. So they've been assaulted over a long period of time. It hadn't happened in a while, but we're going to be looking more for injuries or physical evidence that could be indicative of assaults happening at a younger period in their life chronically. And then our nurses are also trained in conducting strangulation exams. So lastly, I want to talk for a few minutes about forensic interviews. As Diane said, all of those rooms again are also set up to be sort of warm and welcoming, not quite so sterile for our victims as they come through the centers, but also not something that's not going to trigger someone. We want to have them very neutral, something that's not going to be too distracting or triggering for a child that's being spoken to. Forensic interviews are recorded interviews that are designated to, or designed to elicit information from children and vulnerable adults. We do interview adults as well, in regards to possible abuse that's happened to them, or when they have witnessed violence against another person. So we do interview children if they've witnessed violent assaults in domestic violence situations or even homicide situations. We're going to be soliciting a free-flowing narrative from them. The forensic interviewers are trained. These questions are going to be non-leading. They're going to be, as I said, kind of just eliciting that free-flowing narrative from the child or from the victim. They're going to be developmentally appropriate. So we're going to be talking to the child a little bit first informally to get a language sample and kind of assess where they are developmentally, so that we can kind of talk to them in their own language, and we're going to try to use their words and repeat those back to them. These are audio and video recorded, and they're going to be remotely observed. So we're going to have law enforcement, or monitored, I should say, law enforcement and Department of Child Safety in another room watching these interviews as they're being conducted. And then there'll be a break or a time where they can follow up and provide more questions to the interviewer to make sure that we are capturing all the information in that one interview setting, and that we don't need to talk to this child again about that traumatic event. Lastly on that, all I would just like to say in regards to each of these services is that all advocacy centers around the state really appreciate the coordination and cooperation that we receive from the other agencies on our multidisciplinary teams. And this really is how we can best serve our children when something has happened to them.
Thank you, Missy. My name is Marina Auerbach. I'm the program coordinator over at Child Help Children's Advocacy Center in Phoenix. And we primarily serve children, victims of crime, that attend our center. We also serve those children who attend our center because their parents or caregivers have been victimized. The center was started in 1998. Over on Central and McDowell, and that is our new location, is just down the street from there. And Child Help Children's Center of Arizona served abused and neglected children by providing treatment, intervention, and investigation services. Today, I'm going to talk a little bit more about the wraparound services beyond the SANE exams and forensic interviews and the MDT teams that you've already learned about. There is more to an advocacy center. About every 10 seconds, a report of child abuse is reported to a Department of Child Safety nationally. An advocacy center is a comprehensive victim-focused program in a facility that houses law enforcement, child protective services, victim advocates, and medical professionals to work together as a team to help these victims of crime heal and find services. Some of the wraparound services that are included in advocacy centers may include hotline services. They may include child and family-focused waiting areas and playrooms. They may include victim advocacy services, and they may house clinical services such as trauma therapy, occupational therapy, pet therapy, and substance abuse and referral resources. In terms of hotline services, most centers are able to accept calls from the general public in terms of how to get to the center, what services the center provides, as well as serve any victims, no matter of their age, gender, religion, and sexual preferences. They're able to serve victims no matter of their immigration status and no matter what type of victimization had occurred, past or present. The centers statewide and nationwide aim to provide resources and referrals for shelter or safe housing, ability to create safety plans, whether emotional safety plans or physical safety plans. They're able to provide resources or referrals for therapy services. They're able to explain to the general public what happens to a victim if a crime is reported, or where to report a crime once it happened. They're able to discuss legal options or the family court system and make the correct referrals, and they're able to help the victims obtain an order of protection or emergency custody through family court. Child Help has a national child abuse hotline, 1-800-4-A-CHILD or 1-800-422-4453. This national hotline gives children and parents, as well as the general public, the ability to call, text, or chat online for 24/7 access to resources, referrals, and crisis intervention. The hotline is staffed by therapists that are able to walk a child in a dangerous situation and come up with a safety plan, or access emergency services in their location. They're able to refer the child or caller on next steps and who needs to be informed of their situation, or they're able to just comfort the child and listen to what that child is saying. All of the calls are confidential, and callers can call anonymously as well. The hotline is a valuable resource for mandated reporters as well. Mandated reporters are those individuals who work directly with children, such as school teachers, preschool teachers, coaches, medical staff, or anyone really working with children. The Child Help National Hotline is able to walk those mandated reporter to the correct number that they are needing to call in order to make a report of child abuse. In Arizona, our child abuse hotline is ran by the Department of Child Safety. Mandated reporters must call 1-888-SOS-CHILD if they are aware of a child being hurt in any way. Arizona law requires certain people, so those people working with children who suspect that a child has received a non-accidental injury or has been neglected, to report their concerns to the Department of Child Safety and their local law enforcement. Children often tell a person that they trust, and those individuals are then entrusted by the state to call the child abuse hotline and report that crime. How do children come into our center? Most of the time, children that attend Child Help or come into the center have been victimized or have observed a crime occur. On occasion, we do get children and families that come into us from the community looking for resources and referrals, and we're able to assist as well. What happens is a child is often victimized or traumatized in some way, and that crime goes reported to the Department of Child Safety or local police enforcement. That triggers a case to get initiated and for the child to come in for either a medical exam or a forensic interview. In many cases, the police department or child safety units are co-located within the advocacy centers to work the cases as a multidisciplinary team. There is no need to get a referral. The child is brought to one location, such as a child advocacy center or a family advocacy center, to get the investigation started. The ability to come to one place allows a child to only tell their story once to the forensic interview instead of jumping from one social service agency to another. In the case of Child Help, we have the Phoenix Police Department Crimes Against Children unit co-located within our facility, and many of our cases are direct referrals from that unit. A child that comes into the Child Help Children's Advocacy Center comes in through our lobby and waits for services in our playroom. Our playrooms are staffed by designated child advocates that are trained to be trauma informed and meet the sensory needs of children who have been traumatized or abused. At Child Help, our designated children's waiting area is also sometimes staffed by volunteers. Those volunteers also go through trauma training to be able to talk to the child on their level and to be able to play without asking any information that the child should not disclose aside from the time that they are being forensically interviewed. Children wait in the playroom for therapy services as well if they are at Child Help for ongoing care. The designated waiting spaces ensure that children are safe, their needs are met, and that they are able to receive snacks and food as appropriate. If the case arises that the children need shoes or clothing, the child advocates are able to provide that to the children as well and make them feel whole, clean, and as if they belong. Some of the children, this might be the first time they are receiving something new, and all of our donations from the community are brand new with tags so the child can experience something that they could call their own. When an investigation concludes, a lot of these children may receive a small token gift at the end of their time at Child Help, a way to ensure that they understand that the Child Help Children's Advocacy Center and advocacy centers in general are a safe place and a place that their trauma can be healed. Victim advocates often meet with the non-offending caregivers to provide resources and referrals. The victim advocates are able to walk the family through the court process. What happens after the investigation is initiated? They are able to accompany families to court appointments. They're able to accompany and help families who do not have a legal residency with a U visa application so that they are able to stay in the country legally through the duration of the investigation. They are also able to help families apply for victim compensation, and they follow up with families and victims with their ongoing needs, such as perhaps finding shelter, finding a new school, or providing them a food box. Child Help Children's Advocacy Center has bilingual advocates that are able to walk families through the investigation process and provide resources and referrals in their language of choice. Many advocacy centers house clinical services on site as well. All advocacy centers are able to provide referrals and resources to local agencies that serve victims of crime free of charge for trauma therapy. Child Help provides mental health play-based therapy to children ages 3 to 18. Clinical services are at no cost to the family. Child Help has 2 designated therapists that serve children who have been victimized due to parental substance use or substance abuse. The U.S. Department of Health and Human Services estimates that about 1/3 to 2/3 of children who find themselves in the welfare system find themselves there because one of the caregivers was a substance user. It's very important that we have specific trauma therapists that are able to focus on overcoming substance abuse within the family. Child Help has also added occupational therapy or sensory modulation as part of the trauma therapy. The trauma therapist is able to work with an occupational therapist to meet the sensory needs of the child. A lot of victims of crime as children, they have sensory needs because of that crime, such as fear of loud noise, eating difficulties, sleeping difficulties. Occupational therapists play a vital role in helping those children heal. Therapists are also available for immediate interventions if a child is distressed or if a death notification needs to be made. We also offer pets as an ability or as a way for children to heal as well as to feel comfort. You'll see Dallas, our service dog pictured. He is able to go into therapy services as well as forensic interview services to help a child tell their story. And below you'll see Riley, our therapy horse, able to come into the playroom and play with the children, teach leadership skills to the children as they're able to brush them, comb him, and also take him on a walk around the block with their therapist. Advocacy centers served over 300,000 children in the past year. So we thank you for your support and encourage you to tour a local advocacy center near you to see the wonderful resources available to the community.
Did a wonderful job explaining our advocacy centers. Thank you so much, ladies. A family advocacy center is near you in Arizona. We have 22 of them. And the belief is that as a multidisciplinary team, we can better assist victims of family personal violence, having a team of experts to assist you in one location on that private, warm, accepting environment that they have. If you are an adult, you can choose to involve law enforcement or not. Our services remain the same either way, and there's no charge for you. We are here for you, the victim. Our services are confidential. They're free, as I said, to any victim of crime of abuse. Do you know what your rights are as a victim? Let a family advocacy center advocate talk with you, work with you, explain your rights, and take you down this path so that you understand and know what is available for you in our state. Arizona Child and Family Advocacy Network is the nonprofit chapter which all of the 22 family advocacy centers in the state of Arizona are members of. If you look at this chart, it shows you those that were served and how many in each of the categories. 21,030 victims walk through the doors of a family advocacy center or a child's advocacy center in the state of Arizona. As you look at this chart, you will see the largest calls for service are for victims of domestic violence, followed next by victims of child sexual abuse. This is a way that we can reach out to victims and we can help them through family advocacy centers. And or Arizona Child and Family Advocacy Network, this is a list of the centers that they have and where they're at and how you can contact them. You might forget this, and if you do, you can go to acban.net and put it on your web browser, and it will bring up all the advocacy centers, the one that's closest to you. And just because you're in a small community, don't think there's not services for you. Even if there's not an advocacy center, there could very possibly be a multidisciplinary team, which Misty went into detail telling you about, which can respond to you and help you with your services, just the same as a family advocacy center. So in end, what I'd like you to know is that Arizona has many family advocacy centers that can help you. Remember, in 2019, over 21,000 victims were assisted that walked through these doors. They received personal assistance. They receive confidential and free services, including their therapy and all the different things that they need. Please don't remain a victim. Don't be afraid, and don't think you have to walk by yourself. You're never alone in this. This is why we're here, and this is what our job is. Please reach out to a family advocacy center or a child's advocacy center if you or someone you love or someone you know is the victim of family violence or sexual assault or sexual violence. You don't have to walk alone. Thank you to the governor's office for allowing us to share this information with you and let you know how important you are to all of us. Thank you so much. And Gayleen, it's back to you.
Thank you, everyone, for that wonderful presentation and overview of family advocacy centers. For more resources on domestic and sexual violence, please visit itcanstop.az.gov. Thank you.